I am Dr. Susie Houston. I am having a little bit of technical difficulty. There we go. With the start of our recording today. So this is the month of May almost over, and I've got a couple of hot topics that I wanted to share with you all related to our diabetes support and resource recordings. I work at the Lifestyle Medicine Clinic. We are now known as ECU Health Lifestyle Medicine Clinic, and we can still be reached at the same number, 252-847-9908. So I mentioned my name. I'm Susie Houston. I am a doctor of nursing practice in adult gerontology, nurse practitioner, and I'm a certified diabetes care and education specialist, and that's a mouthful for diabetes educator. I'm also a PWD. I'm not sure if you've been on before and we've brought that up, but that is a person with diabetes. So try to get away from using that word diabetic and trying to use diabetes because we don't want to be known and termed by our conditions. So we are going to get started. Now, originally this topic, I don't know why I thought the two would go well together, monitoring and medicines, but it was going to be a super long video. So I'm going to try to keep it under 20 minutes. So here we go. All right, so diabetes prevention and diabetes management at the lifestyle, let's get rid of that, at the ECU Health Lifestyle Medicine Clinic, it combines two worlds. So we want to try to help people prevent type 2 diabetes, and that would be with our diabetes prevention program that is going across the nation, maybe the globe, I don't know yet, but I know for sure across our nation, and loads are happening in North Carolina. And at our Lifestyle Medicine Clinic, we are trying to merge diabetes, self-care, education, and management with lifestyle medicine elements to help people get the best of both worlds, understand dynamics that they need to manage their diabetes and things that they might not necessarily have gotten when they've been working with their provider. It's just these educational components that sometimes get overlooked until something significant happens. And then we're trying to get that incorporated into things that you don't need necessarily a prescription that you take to the pharmacy and fill, but lifestyle medicine components, habits, changes that you can do that can help manage type 2 diabetes, decrease medicines, decrease doses, and possibly reverse type 2 diabetes. There is that possibility. It depends on many factors, if you're ready for a change, if you're committed to your health, and how long you've had diabetes. That plays into it. But no matter how long you've had diabetes, today's a new day, and today may be the day that you decide to take on diabetes and get it by the horns and do something different about it, because you can do loads, okay? So welcome back. If you've been watching some of our recordings since we started doing them, it's me again, and we usually always have a virtual snack. I'm going to drink my lemon water. But it's just a reminder, when we used to meet, from historically we had group meetings, we all met at a location, different places across Greenville, and we would always have a snack, and so we got to eat those. I had to remind people though that the snack, the way it was laid out, was enough to be less than 15 grams. But if you came back for seconds or thirds, that responsibility wasn't put on me. I'd explained that those snacks we had, if you ate the way we talked about before the snacking began, then that would help you not have any rises in blood sugars after our support group meeting. So today we've got like lemon water infused with real lemon. You could also use those real lemon packets. They come and it's dehydrated lemon or lime. You could throw those in. Or you could get a bottle of lemon juice, or those lemons, you know, in the grocery store, lemons or limes they have, and you just squeeze a little bit in. Give it a flavor, and then you can kind of jazz up your water so you weren't bored with the plain old, same old water. Now, I don't know about anybody else's garden, but all this rain we've had has sure made things grow. So my lemon balm is probably about this high. It's gorgeous. You crush it in your fingers and it just makes you smile because it's all citrusy coming from those green leaves. So if you do have opportunity or got a little space in your yard that likes that has sunlight, just be careful. Some of those mints and lemon balms, and I have chocolate mint, spearmint, and lemon balm. They can take off, and then they can be a huge part, and they want to be in every part of your garden. So we got that, and then on the other side, I'm not sure if you can tell what that is, but it's got a little bit of crushed pepper on it. The top is a ball of mozzarella cheese, low fat, a little leaf of basil, however you say it, wherever you come from, and then half of a cherry tomato or a teeny tiny Roma tomato. Those are going to be next to no carbs. So you could have those. And if you were going to try to make this in a meal, maybe you had 3 little spears of that, or you sliced them and put them on a plate with some balsamic vinegar and oil and had a little bit of crusty bread and a salad. And that would be your meal. So that could work out. But for this, it's a snack and it's going to be next to no grams of carbohydrates. So May, Sparks People is known for their calendars, and I like it because it's got a different activity for every day of the month, for every day of the year. And if you use them every year or every month, you would forget what happened last May. So for the 25th, which I do believe it's today, I really had planned to get this out the first week of May, but now we are at the last week of May. So for the 25th of May, it's talking about days to stronger bones, 31 days to stronger bones. So we do want strong bones. We don't have to take medicine if we don't have to. And this is part of lifestyle medicine. Awesome. No side effects to lifestyle medicine. All right, so hold the salt. Diets high in sodium, especially the table salt, shake, 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 increases calcium loss through the kidneys. And our kidneys are important with diabetes. We want to make sure we take good care of them. And now, even important, we want to make sure we're taking good care not to lose calcium through our kidney excretion. So start thinking about, could you lower your sodium? Could you leave the salt shaker up in the cupboard or not even buy it? So think about herbs and spices. So lemon balm might do something, basil might do something. We've got herbs and spices that you can add in. They'll change up the flavor and enhance things, so you might not need the salt. Try to keep sodium to a minimum under 2,300 milligrams. Now, this 2,300 milligrams per day, that's if you don't have diabetes or high blood pressure. I'm going to say diabetes and high blood pressure because they go together usually, almost like one doesn't go with the others, especially type 2. And in that case, I would say 1,500 milligrams is your daily intake for salt. So be super cautious of what you are buying out there. As soon as you leave the house, you have no control unless you read food labels about what's getting put in, okay? So on to our topic for the day, monitoring. So, oh my diabetes supplies are going to cost how much? I don't know if this has happened to you, or even about your medicine supplies. They're going to cost, what? In some cases, we probably have a look like that, and it's no joke. Monitoring supplies for diabetes can be expensive. So we've got some tips, we've got some thoughts, some ideas, and I want you to use your strips as wisely as you can. And when I say that, I just came to my brain, and I don't think it's on the slide. Test strips expire. So make sure if you've got bunches, it used to be in the day. I don't know if they do it anymore, and if they do, somebody call me. We need to stop it. But there are some diabetic, I'm not so keen on that word either, diabetes supply stores that, or durable medical equipment, and you order things, and it's almost like you're on an ongoing order, and they don't even ask if you're using them. They just keep sending them to you. Well, guess what? Insurances get billed for this. And if you're on Medicaid or Medicare, we're all paying for those things. And that might be what's making the prices go up. So let's try to be mindful. If we're not testing 4 times a day, be honest. Don't get all the strips. Get what you need. Use what you need. If they're monitoring, a bottle of 50 strips, that's $50, especially for the brand name meters. That's a lot of money. I don't want people throwing it away, okay? So there are a load of meters, and this doesn't even speak volumes. And if you see yours up there, okay, that was a lucky picture for me to put up there. If you don't see it, don't worry. That doesn't mean it's not the right meter. The right meter is the one that your insurance is going to pay for. The right meter is the one that you're going to use. The right meter is the one you know where it is, you haven't lost it, and it's not causing you big bunches of problems or costs at the pharmacy. Okay? There are all sorts. Nowadays, it takes teeny tiny drop of blood, teeny tiny seconds to do it. You need things. You need a monitor. You need a lancet. That's the little sharp needle. You need a lancet device so that you put it in there and it only goes and punches your skin a teeny bit to get the teeny drop, not go all the way to the bone and cause you to grief and pain and not want to check. So you need all those things. You do not need alcohol pads. If you're in question about, you want to make sure, and I didn't put this on any slides, make sure your meter does not stay in the car. Kind of like you do not leave the children or the dogs in the car in the hot, stinky weather. Even round the clock when it's cold, meters don't like temperature changes, and that can mess them up and the strips. So be super cautious because, you know, your glucose and your life and your sugar and your diabetes management depend on it. Take good care. Don't leave it in the car. And then we've got, so there's lots of meters, there's lots of different styles, colors, whatever. If purple works for you, then maybe that's the meter you need to get if you're going to use it. If you're not, then don't need the supplies, right? Okay. Alcohol pads. Now, I'm not a fan of those because they dry your skin out. And when you've got dry skin, more at risk for dry, cracked skin. Also, when people tell me that it hurts more, well, here's the thing. You may be using, I had that little pad earlier, you may be using the pad of alcohol, but think about it. It's tiny. You only want to do one wipe, let it air dry. Air dry. So none of this, we got loads of germs in our mouth, so we don't want to be blowing it back on our finger. You're air drying it, and then you're poking it. If the skin is still wet from the alcohol, and you puncture the skin with a needle, the alcohol is going to leak into the hole, and it's going to be a bit stingy, a bit owy. And the alcohol that goes in that hole, it's going to damage the tissue so that it doesn't seal as nicely when it heals up. So the best you could do, wash your hands, soap and water, and call it a day, dry them, and be ready to check. And if in doubt, if you're in your house, we're never going to be in a sterile bubble. Your hands may just be clean. But keep in mind, if there was jelly or jam or a condiment on your finger or oil or grease, that could interfere with your blood sugar value. So my lesson learned there was I was making fruit salad in the kitchen, had the watermelon all chopped up, and my alarm was going, so I thought, I'll check my sugar. Well, I did what you're not supposed to do. I just ran over and checked my sugar because I was still working in the kitchen. My sugar said 432. I was like, that's odd, all day. And then I realized, oh my gosh, this is what happens to some of my patients, and now I'm the one it's happening to. The sugar from the watermelon was mixed in with my blood, and it made it go up. So when I rechecked, my sugar was 89. So anyone that takes insulin, what could have happened to me when I had a 400 some number, and really it was 89, and it was really the watermelon juice on my finger that caused the 400 some. And I was about to take my insulin pump out and bolus insulin, like an injection. What would have happened to me, or could have? I could have taken way too much insulin, and it could have knocked me out. I could have died, because if you take too much insulin and your body doesn't need it, worst case scenario is you could die from a severe low sugar. So thankfully, my little head was thinking, right? And I rechecked. So if in doubt, go clean your hands again and recheck with your monitor. Then we've got nowadays, and this has been over the last, oh gosh, more than 10 years, but they've been making big leaps and bounds with continuous glucose monitors. And the wave of the future, I see, and I hope it happens sooner rather than later, is that more and more people and providers, even primary care, will be writing prescriptions for patients so that they have a continuous glucose monitor. Are they covered by all insurances and all people with diabetes? No, not right now. But it doesn't hurt to put in a prescription to see if it's covered by your insurance. If you are on 3 to 4 injections of insulin, yes, it should be covered. Can you buy it on your own? Yes, but you need to compare and check the prices because they can be pricey, and there are monthly fees. So there is like usually 2 parts. There is a sensor, like you see this little disc, and a reader. Now you could have a sensor like this that goes in your arm, or you could have an app on your phone like this is a Dexcom. So this is a Freestyle Libre. Already it's had 3 different generations. I think a 4th is coming. Can't keep up. Let's see. So that's a Freestyle Libre 2, and it goes 14 days, and then you change it again. So sensors, continuous glucose monitor sensors, pick up blood sugar in real time from your interstitial fluid, the liquid in between the skin and other stuff along the way in the tissues of your body. So instead of one finger stick with a glucose monitor, and you have a continuous glucose monitor, getting 288 sugar checks in a day with just you having it sitting on your skin and going into just underneath your skin. So the next one is the Dexcom, and it is a little bit, if you had to pay out of pocket, the Freestyle Libre is going to be one of the more cost-effective ones, but you can look up online, check with your pharmacies to see, and check with your provider to see about getting a prescription for it. So you got the Dexcom, and it goes onto your stomach. That's where they did the studies, and it can talk to your phone. Does it talk to all the phones? Not quite. There are some people that just have some challenges with the phone that they have, but there's a receiver that you can get that goes and coordinates with it. Another brand of the CGM, continuous glucose monitor, is the Medtronic Guardian, and it's been around for a while, and originally it came along with the Medtronic insulin pump. So that's another option. And then the latest is an implantable one. These other guys, you put them on yourself. You maybe get a little training, or you pick up your prescription at the pharmacy and away you go. You watch a video and you get started wearing it, because they make it relatively user friendly, and I want to say easy peasy, but sometimes easy peasy isn't easy peasy for me. Okay, so Eversense is, there's this little tubular device, and it's a sensor, and it's tiny. It goes under your skin, and you go to the endocrinology office usually, or a provider that prescribes it, and they put it in, and it lasts 3, and I've realized that now they can last up to 6 months under your skin. And it just gets implanted just barely under. It's not a deep procedure. It takes minutes once that provider knows what they're up to and doing and practiced with. And then it's not sealed with sutures. It's steri strips, because it's just slightly angled under your skin. It's very cool. It's not for everybody, and not all insurances will cover it. But imagine 3 months of wearing a sensor, and there's your blood sugar in real time coming up on your phone. Okay? So monitoring, a big deal is this. So what's the best monitor? It's the one that you're going to use. It's the one you're going to afford, can afford, the meter and the test strips, and you know where it is, and you know that it doesn't need a battery, stuff like that. You know how to get customer support. Back of every monitor, CGM, continuous glucose monitor, or the glucose meters or monitors, they all have a 1-800 number on the back. I often think it's to check your vision, because it's in really tiny print. So make sure you have that number, because if in doubt, you need to call that company and say something's not working with it, or problems that you're having with it, okay? I also want you to can compare. Just because we have insurance doesn't always mean we get the best deal for some of our medicines or products. And none of us can go to Canada or Mexico just when we feel like it to get some of the medicines that are covered for lower cost and no copay. But with the monitors, the glucose monitors, you can go to, most retail pharmacies have a brand in their store. And I threw in Walmart, because Walmart would be my friend if I didn't have insurance. I would be going to Walmart to get my insulin, and I would be going to Walmart to get my monitor. Because if you're paying more than $20 for a monitor, you need to think about going either to Walmart or any retail pharmacy to see about their store brand meter, compare the costs, okay? Or go online. If you're online savvy, you could check some prices. If I didn't have insurance, I would be online, and the meter of choice that I would go for would be iHealth, or One Drop, or Dario. Okay, though they have some cost-friendly monitors that also relay the information to your provider or your phone. Okay, and also if you're paying more than $10 for a bottle of 50 strips, then even though you got insurance, you need to think about perhaps using a retail pharmacy store brand monitor, not the brand name monitors. Okay, because when you buy those off the shelf, they're like $60 to $80 for the meter, and the test strips are at least $1 a piece. Okay, so buyer beware is all I can say, and double check on the prices for that, and make sure. If you ever have any questions, I'll be glad to help you out. You just need to email me or call me, and I would be more than happy to help figure out something for you. But for right now, there are no free monitoring. Well, mind you, I used to work at an endocrinology clinic, and we had all sorts of meters. I could give you a meter, but I couldn't give you test strips. So I felt like I was a meter pusher. So be very, very, very wary or aware that if you get a free meter, that does not mean you get free test strips, okay? Use caution. Anything free, there's always something going on behind the scenes, okay? Unless you're watching this recording. So things to know. What's the best meter? We just talked about that. The one you can afford, the one you can use. Same with the monitor or the continuous glucose monitor. How to use a glucose monitor or meter. You need to know those things. If you don't know, and you need to know, not your daughter, not your husband, not your grandchildren, they should not be checking your sugar. If they are, tell them to give me a call, and we need to give you a little pep talk, because you live with your diabetes more than anybody else around it. I know it's all in good intentions. They're trying to help, but what if they're not available? You need to be able to check your sugar. You also need to know, when do you check your sugar, and what does the number mean? And then you need to know whether you're in range or out of range, or what's making it go in range or out of range, okay? And are you more often in range than not, then that's a good thing. But if you're way out there in left field with the numbers, that could be a lot of things, and you might need to get connected with an educator or a provider that really is able to help you understand and appreciate all the nuances that you need to manage your diabetes. How to record your numbers. If you're going to try to call in and report yourself, report yourself for with your sugars, you want to have the numbers written down. The person at the other end wants to hear the date. Was it before or after a meal, or was it bedtime? What was the sugar? They don't want to hear, oh, wait, I can't find this. So you need to know how to find the meter. So think about this after you get done listening to this. Where's my meter? I don't even know. Okay, well, that'd be one. Find your meter. Two, do you know how to turn it on? Okay, and they all pretty well have a memory. Does anybody know how to find the memory? Does anybody know how to find the 7-day, 14-day average? I'll let you know on a little secret. If you can get to those, there's going to be a little n equals at the bottom. Guess what that means? So I always like 2 weeks worth of information from my patients that I see that I'm trying to help out. 2 weeks worth of info, 14 days. I can see in the monitor whether it's even worth looking through, because it'll show a 14-day average, great, but then it'll show n equals, that's the number of checks you did. So if n equals 1 for 14 days, what does that mean? It means you've only checked one time. And in the clinic that I used to work at, before I was savvy and understood what was going on, I would take your meter, okay, I'm going to go download it, because that sounded like a great idea. 20 pages later of paper, I'd come back and then I'd go, oh, one sugar is on 20 pages. And then to be nice and kind and give you an opening, I would say, do you happen to have another meter? Usually, oh, no, that's my meter, but you've just told me you check 4 times a day. And I've just got your meter downloaded and there's one sugar reading in 14 days. So you're going to be your best manager ever. You're going to make sure that you got some numbers in there. There is no sense you wasting your time going to an endocrinology specialty visit, or even coming to see me if you're not monitoring your sugar. I would love to be able to help you get a Dexcom or a Freestyle Libre or Eversense. I would love to be able to help you, but we haven't got that for you yet. So in the meantime, we have to go old school. Monitor your sugar so that you can figure out if your medicines that you take are doing the job, or if you start lifestyle medicine changes, are you having results? Okay. So what are my sugar goals, or what are they supposed to be? Or glucose is kind of a formal word. Well, there's the American Diabetes Association and there's the American Association of Clinical Endocrinologists. They're a little bit different. You go down to the bottom, this normal, so normal A1C, no diabetes, should be 5.7 or less A1C. So that's not correct. Don't pay attention. But if you were with the ADA, the American Diabetes Association, they would say it's okay to be less than 7, which gives you an estimated average glucose of 154. So that's nice. The ACE, they say less than 6.5 if you see this bottom row for your A1C, and that gives you an estimated average glucose of 140, okay? So then you got to know, what should it be before a meal? What should it be after a meal? I always look at, stick with a number and work with it. 100 as a fasting number would be like a pretty easy number to remember, right? Close to kind of 100% perfect kind of thing. But 120, you don't want to be too low for your fasting, because that could put you over the edge and have lots of lows. The rest of the day, I like this average at the bottom, 154. If that's where I was trying to help you get to, I would probably say that your sugar should be between 70 to 150, okay? Also, I want to keep in mind that the older we get with diabetes, we're not as spry as we used to be when we're 20. So when I get to be 70, 80, 90, who knows how long I get to make it, I'm going to be okay, and I'm going to let my provider know I'm okay with being my A1C 7 to 7.5, even 8. And please don't tell me I don't get cake for my birthday or your birthday if I'm at a party. Please don't be the food police, because I will enjoy it. It just won't be large amounts. But we're going to be okay that the older we get to be a little wider range, okay? You got to be careful about this 180 that you see, and this says postprandial. So after meals, the American Diabetes Association says it's okay to be less than 180. Well, sometimes people take that, well, 180, well, 200 is not too far off. And the next thing you know, numbers are too high. So if you thought of my little non-association numbers would be 70 as the low end to 150. for most of the time. Now, if your numbers are way high and you're trying to get to this range, it is going to take a little bit of time before you start to feel good in the 150s, because your signal for how you feel has been reset to being okay at 200, 300, and it's going to be reset to being okay below 180, okay, or 140 or 150. But this is a little chart. Any questions, that'd be something we can definitely go over again, okay? Monitoring when to check. Well, I like before meals, each meal, breakfast, lunch, or dinner. Now, it depends what kind of medicines you take. Maybe you only check in the morning, fasting. But keep in mind, this only tells you one point in time how your numbers are doing. First in the morning. We have no clue what is going on the rest of the day or at night. I had recently a provider referred somebody to me because, their A1C was high. It was 8.9, but they said that their fasting numbers were all, that's the only time they checked, was always below 130. But what happens after our fasting moments? Where do we head? I'm hoping you're thinking eating, because yes, we've got breakfast, lunch, and dinner to get through before it's time to fast again. So probably where things are going a bit awry are the meal times, and where this person might not be checking and doesn't have a clue how her numbers might go. So overnight doing good, and then breakfast comes, got down, and then lunch comes, and then dinner comes, and then you just need to know carbohydrates. What are you drinking? Any carbohydrates? What are you eating? Are you overdosing in carbohydrates? Those kind of things can not help with your plan. All right, sugars that are too low, so 70, and in some cases, the older we get, we may even say 80 is too low. Even when I'm 90, I might say, oh, 90 is too low. So it's figuring out where the person's at, how they feel. But the big thing is you cannot go below 70. It needs treatment, and the treatment would be you got to check. You don't want to go by just how you feel, because you may be feeling kind of shaky or sweaty, and guess what? We're in Eastern North Carolina. It's sweaty out there. You could be dehydrated, and that's what the sweat's coming from, not the sugar. And really, your numbers are 300. So you check your sugar here, or look at your sensor reading. If it's below 70 or heading that way, you need a simple, quick-acting carbohydrate. These would be things like juice, soda. It's half a cup. It's not a big gallon. It's 4 glucose tablets, not 1, even though they're big honkers and they're a lot of chewing. It's 4 of those. That gets you 15 to 20 grams of carbs. 3 puff peppermints is my latest one that I love because they are already measured out, they are individually wrapped, and they melt really quick in there, and they can help bring your sugar up. But each one's 5 grams of carbs. You wait 15 minutes. Now, your brain is not thinking clearly because it doesn't have sugar for fuel to think. So it takes a little bit of time. And sometimes we're not patient about this, and it's tough because we don't feel good. We feel like we're going to fall off the planet. Or we're going to get all crazy and crabby and whatever. So you want to wait if you can, because the worst you can do is you guzzle the whole bottle of juice or whole soda, and now your sugar's at 300, and you're like, oh, now what do I do? Well, now you're kind of in a different situation. So you repeat if necessary after you wait 15 minutes and you recheck, okay? Discuss low sugar treatment with your family prior to this ever happening. They may need to call 911. If you're not cooperating or unconscious, they need to call. Another thing to keep handy is honey. It's not up on my little list, but honey can be squeezed right into the pocket of your mouth. Now, cake decorating gel could work, but the thing is, you probably need the whole tube, and there's glucose gel. It tastes terrible. This is an emergency. The cake frosting is not the best because it's got fat in it, right? And it's creamy, so that slows the process. And the other thing with gel is I'll know you had a low sugar when you come in because you're going to have blue lips from the dye of the cake frosting or the gel. But as long as it saves you. So honey in a squeezy bottle, like with the nozzle, that works really well. Glucose gel, there's loads of treatments out there, but if you cannot swallow, the thick stuff in your cheek works the best. So, and your family calling 911. Of course, there's glucagon kits, and that's an emergency too, but that needs a prescription, and a family member would need to know how to use it. There's injections, or there's a squeeze up your nose, okay? But if you're able to swallow, you should be able to treat your own low sugar. And if you're having frequent low sugars, there's something there's something off with your medicines, or you're not eating at the right times to go with your medicines, or you've maybe lost weight and you don't need as much medicine. Or you're super active now and you're doing an exercise routine, and that's causing these lows that then make you eat, which then you'll never lose weight if you have to keep eating to treat a low because you're on too much medicine. So bad things happen really fast, so act fast to fix it, okay? And make sure you're like a Girl Scout or a Guy Scout, and that you always carry something with you. A lot of times I'm like, okay, what you got to treat your sugar? And if people don't have anything, okay, next time throw it right on the desk so we know you got it, and then we move on. But I just want you to be prepared, okay? So with monitoring in too high a numbers, sometimes things can happen that cause numbers to stay high. Well, you just might not be on enough medicine or the right kind of medicine to work for you. Infection could cause your numbers to go high. You're not as active as you used to be. You gained some weight and now you're more insulin resistant. Some medicines can cause it. You get a steroid injection or two to help for pain with other parts of your body. But these bad things with the high numbers, it's like a little teeny pickaxe. So sugar floating around in your body, they attack your eyes. So it's like a little pickaxe causing problems and wrecking havoc. Or they're attacking your gum line and it's causing problems, like lots of sugar build. So if you have openings, wherever you have openings, sugar gets to go in. And so the sugar, we want it to get into our muscle cells, so it's out of the bloodstream and causing the problems. It goes to your kidneys, it's chipping away. So even though you might not feel terrible bad about a 200 or 250 or 300, the damage that gets done over the long haul is the stuff that causes those chronic complications that people wish they had done things differently when they first found out they had diabetes. But because nothing really significantly like lit up in the mirrors each day to say, your numbers are high, my kidneys are getting attacked, then we just kind of move on and try to not think about having diabetes. So you do need to think about, did I take my medicine? What have I been eating? What have I been drinking? Were you at the big special pasta place where you get refills and refills and the sweet tea is delicious and you just went crazy because you're an adult and you get to eat whatever and drink whatever you like? Well, diabetes doesn't care. So you've got to pull up your socks and be thinking about avoiding sweetened beverages, avoiding heavy carbohydrate meals, understanding even what is a carbohydrate. If you hear this word and you went, huh? Carbohydrate? Then you might want to speak with somebody in my clinic to get a little bit more information. And consider light exercise or physical activity that gets you moving. I love walking because you could open your front door or your back door and walk out 10 minutes and walk back again 10 minutes, and you've just done 20-minute activity, and that could help your blood sugar. So if you're experiencing frequent highs, frequent lows, you need to call and speak to the nurse or go online and send a message in the healthcare portal to your provider. They need to know what's going on, because if you're not taking medicine because you can't afford it, or you're not monitoring, they need to know so they can help you out. But they're going to want some readings to help determine if you need more medicine or less medicine, and of what medicines you need more of or less of. And if you start lifestyle medicine changes or choices and they become routine habits that are sticking for life, guess what? Probably will need less medicine. Isn't that a great thing? So when you do call to let them know, or you type in a message in like the My Chart, you want to put dates, time of day, whether it was before a meal or after a meal. And for a few days, if you've just had one low sugar, you need to do your own detective work and figure out, okay, I took my medicine, then I went and lay down, instead of I took my medicine, I should have been eating. Or I took my medicine and I only drank water and a couple of carrot sticks, okay? So if there's some reasons of why they're low or why they're high, you've just decided you're going to drink all the leftover regulars drinks that were for your grandkids and they didn't drink them, and you're going to drink them, and now you've been running high. So you got to do that detective work before you kind of reach out for help, okay? And please let your family know what's going on. They need to know, because you can be crabby and kind of bitchy and not a nice person when you're lower or high with the numbers, okay? And then the people that want to help are like, oh, the emotions get in the way. So just be thinking that, okay? So before monitoring, I said before, make sure hands are clean and dry. Soap and water works really well. Also, diabetes does not take a vacation. Okay? It doesn't care if you're in school, it doesn't care if you work full time, it doesn't care if you're going to Tahiti. So it's traveling with you, whether you're taking your stuff or not. So the worst that can happen if you're going on a vacation or you're traveling and you have forgotten all your supplies, or forgot you had diabetes, so you left it all at home, is that you end up in the emergency department somewhere around halfway around the world, or somewhere across North Carolina. It's no good. you're messing up the vacation that you're supposed to have a good time with your family or friends. So take your diabetes supplies, your medicine, make sure your medicines and your testing supplies stay with you. They should not stay in a car. They should not go in the checked luggage because you don't want to carry a bunch of stuff. And trust me, this has happened to the best of us because I've tried to cut down on what I take when I travel, and nearly everything that could go wrong under the sun with diabetes has happened to me. Okay, and I have been in Mexico looking for insulin in the pharmacy. I have been in Switzerland trying to get a visit with a provider in an emergency room. So there has been lots of things across the globe that I've had to encounter to try to make sure things were safe for me, managing my diabetes and still living the way I want to live. Okay, so we are diabetes educators and your provider. We're here to help you get your monitoring on the go. So it helps determine if you're on the right path with your eating, your physical activity, and your medications, or your lifestyle medicine changes. And if your readings are not where you want them to be, ask about a referral to a certified diabetes care and education specialist, a dietitian, a lifestyle clinic provider, or an endocrinologist, because we want to help you get your numbers. But we won't know you need help unless you reach out. You also need to monitor A1C. You do. I mean, it gets done, but you need to go, whoa, wait a minute, what was my A1C? And your blood pressure. Every time you go to a clinic, you get it checked. Ask them, write it down. And what's your weight? Shouldn't be a secret. You should be working on it if you need to. Cholesterol, kidney health, your eye health, so you should be getting your eyes checked once a year at least. You should be getting your kidneys checked once a year. That's peeing in the little cup to check for teeny tiny protein in your urine. And your feet. Your job, check them every day. Okay? So get your fruits and veggies in for Memorial Day and May. Think of all the colors of the rainbow. That means you're getting vitamins and minerals. And on this picture, things I see, and I love all of it. We've got blackberries, strawberries, watermelon, cherries, pears, apples, grapes, all that good stuff. Be careful with the fruit. Size matters. So I'm going to just let you know, serving of fruit, half a cup. Okay? Non-starchy vegetables, I'm not even going to show you a measuring cup. Eat as much as you want. If you're taking food to an event for friends or family, make sure you focus on the non-starchy vegetables. Make it the star of your world so that you can enjoy the treats that everybody else brought, okay? And this has got tomatoes, red peppers, cauliflower, and a dip. So enjoy those as much as you go, and don't think twice about having seconds or thirds, okay? So lifestyle medicine for diabetes management, they go really well together. Your health and well-being is important. Consider working on lifestyle medicine activities or measures that can help you with little side effects. And those lifestyle medicine components are things that are similar to diabetes self-care management, healthy eating, being active, risk reduction, managing stress, avoiding risky substances, relationship building, and sleep. Whew. So, diabetes safety, have a monitor you can use, know and take your medicines as prescribed, follow up with your provider as directed, consider wearing a medical ID bracelet, or get this, I have a free diabetes necklace and you can send it to this company. Okay, and medical alert bracelets, they come from stainless steel to platinum, so you can spend as much or as little as you want. And FYI, this would be a stainless steel one. Okay, $25. All right, and then don't forget your water, hydrate daily, and this is forever. So jazz it up with some lemons, throw those in so that then you can get the water a little bit more exciting so that you drink more of it, okay? The great thing I love about water, it is no carbohydrates to count, so zero calories, zero carbs. So at ECU Health Lifestyle Medicine Clinic, we offer one-on-one provider visits as an addition to your primary care. Okay, we have registered dietitians, we have lifestyle coaching, exercises, medicine programs, shared cooking classes, and for people that are truly interested in making some lifestyle changes that can help blood pressure, cholesterol, diabetes, and weight. So call us if you need more information, 252-847-9908. Oh, and same again, just in case you missed that one. And friendly reminder, please share the pre-diabetes risk test. I don't know if it would have helped you when you first before you got diagnosed with diabetes, but if you have friends or you have family that are at risk, please share this risk test, because if they score a 5 or above, puts them at risk for pre-diabetes. And what do you think? That sounds like pre-diabetes is the step before type 2 diabetes, okay? So feel free to share. If you need the risk test as a hard copy to share with friends, family, or your church family, I would love to share it. If you need somebody to talk to any of your groups, I would love to come out and help you out with that and get more information to you. Okay? So if you or someone you know has diabetes and wants to learn more to manage it and get under control, contact me so I can add you to our email list. You will receive the monthly diabetes support and resource recordings and get directed to our website with the topics from the year. Here's my email address, and of course you'll get it sent your way, or you can call me at this number. This is my direct line, and that's the 252-847-1436. So again, that's 847-1436, and our gym topic is talking about what kind of diabetes do I have, okay? So these are our topics for 2022. We're rolling along. Seems like May just went. I don't know where. June, there we go. And then just a reminder, I'm Dr. Susie Houston. I'm with the ECU Lifestyle Medicine Clinic, and you've got our number. Please contact us if you needed more information about managing your diabetes or any of your other chronic conditions. Thanks so much for your time. Bye now.